I would like to introduce a Prechop and Counter Prechop surgical technique that can be used for safer and more efficient cataract surgery. The historical structure of the lens shows that lens fibers from the equatorial region create several onion peel-like concentric layers, while at the same time also producing a steady array of radiation vertically around the Y suture. Dr. Gimbel has pioneered the nuclear fracture technique in cataract surgery, and we have seen many new developments and improvements in surgical techniques and instruments. Before cataract surgery, it is essential to do a slit-lamp assessment of the size of endonucleus and the cortical thickness, as well as the state of the journals. The key factor in nucleus fracturing is to have a good understanding of the status of the central endonucleus. Usually beginning cataract surgeons use the divide and conquer technique for nuclear fracturing. Flexibility and upgrading of the surgical approach to nuclear fracturing is important to deal with a wide range of cataracts. What is your favorite nuclear fracture technique? Let's take a closer look at the Prechop technique, which has quite a steep learning curve. If you understand the basic logic behind the Prechop technique, adopting it in your cataract surgery will become much easier. By separating the nuclear fracturing process from phacoemulsification, the frequency of post-capsule rupture is reduced, and at the same time, damage to surrounding tissue is minimized by using the least ultrasonic energy possible. Moreover, even in poorly dilated pupil, prechopping allows for relatively easy nuclear fragmentation. I have designed a new prechopper, which is different from the traditional sickle-shaped design. The new design is inspired by and combines the advantage of the mechanics of an X and the beak of an eagle. This new prechopper allows the surgeon to get a good hold of the nucleus, while also providing a balanced steady force to fracture it. We need to consider the hardness of the endonucleus to decide on using either the Prechop technique or Counter Prechop method. Contraindications for using the Prechop technique are incomplete CCC, journal-lysis, little to no cortical layers, and very hard nucleus. For any nuclear fracturing method, performing sufficient hydrodissection is very important to reduce journal stress and limit pressure applied to the journals. I developed a 23-gauge double-port hydrodissection cannula that balances and injects BSS into different directions, allowing the nucleus to rotate freely in the capsular bag. After filling the anterior chamber with a sufficient amount of OBD, insert the prechopper vertically and place the tip slightly past the anatypical Y suture in the center of the lens. When passing through the endonucleus, slowly open the brace and the nucleus easily divided. If the nucleus cannot rotate freely due to incomplete hydrodissection, it is possible to perform nuclear fracturing in the shape of a fan. In case mature cataracts with hard nucleus, introduce the universal chopper just below the anterior capsule, following the cortical layer, and position it at the nucleus equator, while the prechopper is placed 180 degrees opposite right before anatypical Y suture. Both instruments should be handled with the same force and approach each other slowly. The prechopper should be placed at the center of the nucleus, and gently opening the blade will fracture the hard endonucleus. If additional nuclear fracturing is required, the Prechopper can be flipped over, placed under the lens center, and by the opening the brace, the nuclear fragmentation is completed. Adding dispersive type OBD will maximize visibility, maintain anterior-chamber stability, and protect corneal endothelium. Even in cataracts with very hard nucleus, I'm able to easily perform nuclear fracturing with very low incidence or PCR by using a 2mm chamfer with a round tip that I have designed. Depending on situation, I'm choose to switch into stop and chop or horizontal chop technique for phacoemulsification.
프리찹을 이용하면 핵을 쪼개기가 정말 편해집니다. 한번 사용해보면 다른 거 사용해보고 싶지 않습니다.
충분히 핵을 쪼개지 못한 상태에서 프리찹을 사용하면 그 핵을 충분히 쪼갤 수 있었습니다. 개인적으로는 이 프리찹이 비기너 분들에게는 좋은 서전이 될 수 있는 징검다리 역할을 하는 기구라고 생각합니다.
심한 핵 경도의 백내장 수술 후 자주 발생하던 각막 부종이 카운터 프리찹 방법을 쓰면서 많이 줄어들었습니다. 수정체 유화술 시간이 단축되고 수술이 훨씬 안전하게 진행되는 것을 느꼈습니다.